One of the things, so in some of my research so far, one of the things that we come up against very frequently as reflexologists and with our clients is painful periods.
Yeah.
So one of the things that we do is if we can't get to treat a client whilst they are bleeding, and that is, of course, when you've got um, most activity in terms of the uterus. So you've got a lot of muscle spasm and creates a lot of pain, particularly for those who, may have something like endometriosis. Then it's really useful to teach them how to do something themselves. So we teach them how to sedate, which helps to reduce the muscle spasm, and it also helps the content of the uterus to clear. So it reduces pain and helps to clear the uterus. So we teach them how to sedate the uterus reflex point.
Yeah.
So I
It-
thought that might be useful.
yeah, that would be wonderful.
Yeah.
Yeah.
So my way of explaining where it is that we start on the thumbnail
Mhm.
and we follow the metacarpal all the way down, that first metacarpal, all the way down to the base. So if you wiggle your thumb, you can actually you come down to the base and find that little dip. You can feel that metacarpal moving. Yeah.
Mhm.
For us, sedation is moving towards the palm of the hand and backwards. So you're in that little dip. I'm exaggerating. So in that little dip, moving towards the palm down.
And what about if it's
Yeah.
quite sensitive? Would that mean anything?
It will be sensitive if you've got someone who has got painful bleeds. You're going to do exactly the same on the other thumb.
Yeah.
Follow that. Whoops, let's move this over so you can see me. So start at that metacarp all the way down, and
Mhm.
then you're moving towards the palm. You're
Amazing.
in that little dip, which is the uterus reflex point, all
Yes.
the way down. Yeah, sensitive.
Yeah. Well, and even if I'm not currently having my period right now, but I do
Yeah,
get difficult periods, so I'm very sensitive.
right.
Interesting.
Okay. So the sensitivity will mean different things for different people at different times in their cycle.
So
And
interesting.
that is a whole other area to talk about.
We don't have an hour.
We don't sadly, but we can touch on that when I come and do the talks. But what I usually say to clients is 3 times 90 seconds on each hand every day they are bleeding,
Okay.
but not to be done at any other time because
Hmm.
whilst they are bleeding, you are helping to clear the content of the uterus. That is what that is doing. It's sedating, helping to clear the content. You wouldn't want to do that as the endometrium, the lining is thickening. You want to be doing something different to that because you want to increase the proliferation of endometrial epithelial cells in the endometrium. So this is only to be used whilst they are bleeding.
Amazing.
Because yeah, so that will help with pain. If the periods are really painful, then they can use that technique for about 5 minutes,
Hmm.
just until they can feel the it takes the edge off the pain, and then it will continue to work afterwards.
It's so great. I'm just envisioning, if somebody is in extreme pain and lying in bed and how easy it would be to just access that hand.
Yeah,
Yeah.
yeah, yeah. Really easy self-care.
Mm.
Really easy self-care. So, 3 times a day, 90 seconds each side whilst they're bleeding. But if it's very extreme, use it for 4 or 5 minutes until the level of pain starts to drop.
So
Easy peasy.
thank you so much. I'm definitely going to try.
Pleasure.
Wonderful. Um,